Okay, if you've ever dealt with back or neck pain, you know just how confusing and honestly frustrating it can be. In this explainer, we're going to cut right through all that noise with a simple but really powerful framework for understanding what's going on and, more importantly, what to do about it.
So here's a situation that I bet sounds familiar. It's got to be one of the most frustrating things about back and neck pain, right? Your friend swears by this one stretch that fixed them. You decide to give it a try, and boom! Your pain is suddenly way worse, maybe even shooting down your leg. What is the deal? Are you just built differently? The answer is no, and the reason why is actually fascinating.
Well, the answer, and this is the absolute key to everything we're about to talk about, is a concept called directional preference. It just means your pain has a mind of its own. It prefers to move in one direction, and it gets really angry if you try to force it in the opposite direction. Understanding this one idea is a total game changer for taking control of your recovery.
Okay, so before we can really get our heads around this whole directional preference thing, we've got to take a quick look under the hood. You know, what's actually hurting in there? Because it's almost never just one single thing.
See, your spine isn't just a stack of bones. It's this incredible, interconnected system. Pain can come from the discs. Think of them like little jelly-filled donuts that act as shock absorbers. Or it could be the small facet joints that guide all your movements. It could be the muscles and ligaments holding it all together, or even the nerves that have to weave through everything. They all have to work in harmony, so when one part gets irritated, the whole system feels it.
Now look, any of those parts can kick up a fuss. But a huge number of spinal issues, especially in the low back, often start with one main character, the intervertebral disc. And what's really interesting is that there's this kind of perfect storm age. Right between 30 and 45 years old, the disc is in a really tricky spot. See, the gel-like center is still nice and hydrated so it can move around, but the tough outer wall has started to get a little weaker after decades of use. This creates the perfect setup for a potential injury.
Right, and an injury like this almost never happens all at once. It's more like a slow burn, a progression. As you can see here, it kicks off with a simple bulge. If that stress keeps up, it can become a protrusion. Then you might get an extrusion where that jelly center actually pokes through. And in the worst-case scenario, sequestration, a piece actually breaks off. The big takeaway here is that a small mechanical problem can get a lot more serious if we're not listening to what our body is trying to tell us.
And that brings us right back to our big idea. Because how we deal with something like a disc bulge, well, it all comes down to which direction your spine wants to move in. This is what we call the directional dilemma.
So you can basically sort most spinal pain into two big buckets. On one side, you have an extension bias. This just means you feel relief when you gently arch your back or lean backward, a movement away from the floor. This is super common with disc problems. On the other side, you've got a flexion bias, which is the total opposite. You feel better bending forward, a movement toward the floor. This is often linked to things like joint arthritis or spinal stenosis.
Okay, so the million-dollar question is, how on earth do you figure out which camp you're in? Well, here's the secret. It's not about how much it hurts. It's about where it hurts.
I'm going to say that again because this is probably the single most important idea in this whole explainer. We are not chasing a lower pain score, not at first anyway. We are chasing a smaller map of the pain. The goal is to literally shrink the territory that your symptoms cover.
And the magic word for this, the thing we're looking for, is centralization. This is our goal. It means that your symptoms, whether it's pain, tingling, or numbness, are physically moving. They're retreating from your leg or your arm and heading back towards home base, your spine. Now, here's the tricky part. Your back pain might even get a little more intense right in the center, but that's a great sign. It's a huge win because it tells you that whatever you just did is helping fix the problem at its source.
And then there's the big red flag, the warning sign. It's the exact opposite, peripheralization. If you do a stretch and that pain that was just in your hip suddenly shoots down your calf and into your foot, that is your nervous system screaming, stop. Whatever you're doing, it's making things worse. This feedback is the most valuable diagnostic tool you have.
All right, so now that we have our compass, using centralization as our North Star and peripheralization as our danger zone, we can start to build a really simple treatment plan.
So let's say backward bending makes your symptoms centralize. Great, you've got an extension bias. The whole goal here is to use gentle, repeated movements into extension to kind of nudge that disc material back towards the center where it belongs.
And the classic move for this is the prone press-up. It's pretty simple. You lie on your stomach, hands under your shoulders, and you just press your chest up while letting your hips stay on the floor. Your back sags into extension.
And the whole time, you're just carefully checking in, are my symptoms moving closer to my spine?
But what if you're the opposite? What if bending forward is what brings relief? Well, then you've got a flexion bias, and your goal is to gently open up the back side of the spine. This can take pressure off those little facet joints or just create a bit more room if things are getting crowded in there.
And a super common one for this is the knee to chest stretch. You just lie on your back, gently pull your knees in, feeling a nice stretch in the low back. And again, you're asking that same question. Hey, symptoms, where are you going? If they're moving back toward the spine, you are absolutely on the right track.
But here's the thing. Finding the right direction to calm down a flare-up, that's really just step one. It's the immediate fix. The long-term goal for everyone, no matter which bias you have, is to build a spine that's so strong and stable that it doesn't get into trouble in the first place.
And the secret to that long-term stability is mastering what's called the neutral zone. Just think of it as this safe, happy middle ground for your spine's range of motion. It's the spot where there's the least amount of stress on everything, your discs, your joints, all of it. Strong core muscles help you live in this zone.
I absolutely love this analogy, the ball in a bowl. A really stable, healthy spine is like a golf ball sitting in a deep bowl. You can nudge it, but it just settles right back into the middle. That's a well-protected neutral zone. On the flip side, an unstable spine is like that same ball on a flat dinner plate. The tiniest little bump sends it rolling right off the edge, straining things it shouldn't.
So how do we build that deep bowl? Well, it's a team effort. You can think of true stability like a three-legged stool. You've got the passive system. That's your bones and ligaments, the actual structure. Then you've got the active system, your muscles, the motors that create movement. And finally, the neural system, your brain and nerves, the computer that tells the muscles exactly what to do. If any one of those legs is shaky, the whole stool gets wobbly.
And that really brings it all home, doesn't it? This quote nails it. The challenge is seeing how everything is connected. The spine isn't just a stack of bones. It's this incredibly complex dance between joints, muscles, and nerves. Lasting relief isn't just about one stretch. It's about understanding the whole system.
So I want to leave you with this question to think about. As you go about your day, sitting, working, lifting your kids, are the habits you have building a deep, stable bowl for your spine, or are they accidentally creating a shallow plate just waiting for the next wrong move? Figuring out your directional preference is that crucial first step to making sure you're building a spine that's strong, resilient, and ready for anything.